Hi, my name is Jean Warner, and I'm a breast imaging specialist at the University of Maryland Medical Center. Today I'd like to speak with you about some of the differences between digital mammography and traditional film screen mammography. And I'd like to conclude by just describing some of the various modalities that are available for breast imaging at a breast imaging center. From a patient perspective, when a woman comes to have her mammogram, having a digital mammogram doesn't really give her a different experience than a traditional film screen mammogram. She prepares for the exam the same way. The exam is still performed by positioning the patient the same way. She still experiences compression of the breast, and the equipment looks the same. The image is produced by X-rays, which is the same as film screen mammography. What's different about digital is that that image is captured into an electronic image, which can then be displayed and viewed by the radiologist on a computer screen. And the advantage of this is just like your digital home camera. When you take a digital image, you're able to change that image once you've taken it, so that you can change the contrast level, the brightness of the image, and make it look better to you. We're able to do the same thing with your mammogram, and that results in us being able to see through certain women's breast tissue better, to change the image, to magnify it so that we can see things better. Some women may be interested to know if digital mammography is truly a better study than a traditional film screen mammogram. Recently, we got the results from a large screening trial called the DMIS trial, in which many women were screened with both digital mammograms and film screen mammograms. And the major results of this trial indicated that there are certain groups of women where digital mammography is better at detecting cancer. And those subgroups of women include women who are under the age of 50, who have very dense breast tissue, or who are premenopausal or perimenopausal. Overall, the study showed that for all women, there is very similar accuracy and detection rates of cancer comparing digital mammography and film screen mammography. Other advantages of digital mammography include the fact that we can very easily store digital images electronically, and they do not have the chance of being lost like film screen mammograms. Another great advantage is that we have the capability of online consultation. So if there's a patient somewhere who has a mammogram and the interpreting physician has a question about it, they can easily electronically send those images to a breast imaging specialist who can render a second opinion for that patient. At a breast imaging center such as ours at the University of Maryland Medical Center, we offer all of the services that a woman might require for the workup of a breast problem. For instance, if a woman has a breast mass, she would come in and receive a diagnostic mammogram, which the radiologist would review at that time. In this case, ultrasound would very likely be required, and that would also be performed by the radiologist during that same visit. She would then consult with the radiologist and be informed whether or not this was a suspicious finding on her imaging studies. If a biopsy of a lesion would be required, this service would also be provided at our center and could be performed under ultrasound guidance or mammography guidance or even MRI guidance. Some women may require MRI of the breast for evaluation of their problem, and this service is also provided at our center. We, as breast imaging specialists at University of Maryland, also interpret the breast MRI, and we interpret it in conjunction with all of the patient's other breast imaging studies so that we are able to give the patient a final conclusion and impression of what she should do for her treatment. Breast MRI is a relatively new imaging modality that we use. It's not for everyone, but it has been shown to be quite effective in certain subgroups of patients. And those patients include women who have been recently diagnosed with breast cancer. A study that was recently published in the New England Journal of Medicine indicates that women who are recently diagnosed with cancer have a relatively high chance of having cancer in the other breast that may otherwise go undetected without the use of MRI. So I recommend to any women out there with a recent diagnosis of breast cancer that they consider having this additional test before their surgery. It's also quite helpful in just evaluating the extent of breast cancer in the breast where it's known to have occurred. And it's also very useful in screening high-risk women, and that includes women who may have a very strong family history of breast cancer and women who have been tested for genetic breast cancer so that they know that they carry a breast cancer gene. Also, women who have had a prior history of cancer such as lymphoma and have received radiation to their chest in the past are at quite a high risk of breast cancer and may benefit from this additional screening tool. Once you've made that decision to schedule your mammogram, please consider scheduling it at a breast imaging center, such as ours at the University of Maryland Medical Center, where we will provide you with all of the imaging modalities that might be required to evaluate any breast problem that you present with. Not only do we offer the latest technology in all of breast imaging, as well as the latest expertise in breast imaging, we also take a multidisciplinary approach to our patients and provide a whole team of physicians to not only diagnose your problem, but treat any breast problem that you present with. This includes our breast cancer team of breast surgeons, radiation oncologists, medical oncologists, pathologists, and radiologists such as myself. I'm Dr. Jean Warner from the University of Maryland Medical Center. Thank you for watching.